Good evening, ladies and gentlemen, and Happy New Year. What will 2022 bring us? Will your mental health hold up? Are you ready for a fourth booster vaccine? Are you ready for QR codes for vaccine IDs? Why does natural immunity to COVID still continually be ignored? Is it really about your health or control at this point? Just some questions to ponder. It's 2022, we must move forward. Tonight's lecture is geared towards new patients, but also current patients. Current patients that need to hit the reset button and start from the beginning. This will be an interactive lecture that you can email our office for the form that I will be going through during the middle of this lecture. We are going back to the beginning. You get to hear my story all over again. Here's my contact information. The definition of insanity is doing the same thing over and over again, but expecting a different result, different results. COVID cases go up, lockdowns in certain areas, recommend more masks, more vaccines. We are beating our head against the wall with this, doing the same thing over and over again, expecting something different. It isn't working, and it should be pretty obvious to a lot of people at this point. Your doctors used to swear and take a Hippocratic oath to do no harm and to serve you to their best of their abilities. I'm hearing stories of my patients, heaven forbid you have to go into the hospital with COVID, and they ask you if you're vaccinated or not. Your quality of care may depend on how you actually answer that question. If you are losing sleep over what is going on in the world today, I'm going to help you out on my next lecture. Health begins before you wake up. Dr. Gill's got a great lecture coming up, How Your Job is Killing You. And Dr. Tent will be doing, he hasn't pinned a date just yet, but where are we going? Either April or August. If you are unhappy with the doctors that you are working with and you want a second opinion, we do virtual appointments, and we have had great results with patients, and we love to help you as much as we can, or even get you in the right hands for that matter. We are all over social media, Instagram, YouTube, Facebook. Connect on one of the social media outlets. We are absolutely everywhere. I'm most active on the Instagram stuff. I think we're going to drop the blog at the office. I like the Instagram and the interaction with that. If you click the little story thing, I normally run a lot of the stories. I'll do live things every other week and that kind of thing. The early part of the year, beginning of the new year, I was walking you guys through the NutriClear 15-day detox kit of biotics. This kit runs about $160. It's a nice little reset thing for patients, a little quick 15-day thing. 2 shakes a day, 2 detox packs a day, some snacks, and a normal dinner. Pretty easy to do. I've had great results with myself, great results with patients doing it. They've enjoyed how I've kind of walked them through the Instagram stories on how I have done it in the past and how I recommend it for patients, especially if they're trying to lose weight, not lose weight, just cleanse, whatever. You want to feel better going into 2022. This is something where you want to start. If 15 days, I should say, is a little too long for you, the 7-day orthomolecular kit is a better option for you. This is the one I actually did this month. While I was talking, we went through the other one. I want to change it up and try a bit of a different one. This orthomolecular one's a chocolate flavored one. Less supplements, easier to get down. 2 pills twice a day for the first few days and 4 pills twice a day. The shakes are tasty, and it's kind of the same thing. 2 shakes, a few snacks, and a normal dinner. Very, very easy and manageable to do. Doing this with a lot of patients just to do a quick 7-day reset before I jump in and doing other things with them. This one runs about $110 to do this kit. After I got done doing this at the beginning of the month, I jumped right into doing a full keto base thing throughout the month as well. And I even jumped on the Instagram story coaching you guys and showing you guys how I do keto in a healthy version. Some of you guys have to learn to fail forward. Hey, you crap up on your diet one day, binge on food, sugars, whatever. Pick up the next day and just keep going forward. It's baby steps in health for you. A lot of people aren't used to taking a bunch of supplements and have bad diets and pretty much really need a lifestyle change, but fail forward, pick up and get back on it the next day and keep going. You're a patient in our office, you've had good results and you want to talk about it, we'd love to record you on our Instagram stuff. And can give you a little bit of a testimonial as well. If any of our lectures and things get scrubbed off YouTube or whatnot, we're on Rumble, other social networks, Gap, TikTok, whatever. The Rumble ones won't be taken down, but if something's taken down off our YouTube channel, it will be posted elsewhere. This is our team. We work hard for you guys. We work together on certain cases as well too. We love to serve and we live to serve. If you have had good results with us, share it on our Google reviews. We'd love to hear from you. New Year's was pretty fun with my kids, my wife. This was New Year's Eve. We went downtown Campus Martius to go ice skate in downtown Detroit. My first time on ice skates this year, and I caught an edge and I went down pretty hard and I took out my wrist pretty good. New Year's Day, all the urgent cares are closed. I thought I fractured my wrist because I woke up in the middle of the night. My wrist was throbbing, swollen, and I couldn't move it. I'm like, crap, this is not how I want to start off 2022. I got to adjust patients come Monday. I can't afford to have a broken wrist and deal with this. I dragged one of the girls to come in the office, take a quick snapshot on my wrist. I thought for sure I was going to see something broken over here or in the outer part of my bone. And nothing, thankfully, but I sprained my wrist pretty good. And a few things I did to heal this up pretty quickly, because I'm going on about 4 weeks, and I'm like 95% better with my wrist. Bios, I played my bone, I played my ligaments, increased my calcium. Intenzyme Forte, this was a nutritional steroid. I could not even move my hand back. I couldn't put pressure on it. It was swollen. 3 days of this acted like a steroid on an empty stomach, 3 times a day. I got all the swelling out of my wrist in a matter of 3 days. That's how fast that worked. I used the polarizer, stem cell cream, and I used some compression. It worked wonders. Dr. Tent did some similar things because he sprained his ankle walking in the dark and missed a step. He did a lot of the similar stuff, as well as that polarizer and the stem cell cream on top of that. You play the things right, a 2 to 10 week injury, 3 to 4 weeks, and I'm back. I can't afford to, this is my career, I cannot afford to have that be out with something like that. I swear, the shakes that I have always recommended to you guys, the collagen is probably what saved my butt from shattering that wrist. Skin, hair, nails, bone, joints, patients losing their hair with COVID, post-COVID, I start them on a collagen right away. I need a functional shake for a lot of you patients. Last lecture I talked about this Mudacor protein powder. This is a more of a functional shake for you that has cellular energy components and things that help boost the glutathione levels in your body. So you're getting your nutrition, you're getting your protein, and you're getting functional components that work at the cellular level to help you metabolize and work things through your phase 1, phase 2 detox pathways and give you energy at the cell level. When I did talk about this at the previous lecture, this was on back order. Like I said, we've had issues with biotics and some of their products when their chain supply being on back order. GSH is glutathione. If you have any of the MTHFR mutation issues, you need to stay on top of your glutathione stuff, because that deals with your detoxification components. And if you have the MTHFR mutation, you don't digest folate to help produce glutathione that deals with your detoxification. The GSH Plus has the NAC and it has the glutathione all together. If you are going to survive going forward, you want your antioxidant levels strong. You want your glutathione levels up no matter who's shedding whatever today. This is a patient, he's probably about mid-late 40s. You see the date on this is 11/18/21. He was checking for his COVID antibodies, which he had COVID a year before this in December. This is a year later in November, and he still is positive with COVID antibodies. Now your TV says, oh, COVID antibodies only last about 3 months and you need to get another booster vaccine. No, we are running antibodies on patients and they are lasting longer than that, despite what your TV has been telling you. So natural immunity of SARS-CoV-2, whatever, immunity persists for up to 11 months following infection. Why? I cannot understand why natural immunity continually is being ignored. If you have had COVID and you have antibodies, you shouldn't be forced in needing to get in a jab in your arm that is not really necessary. The literature is out there with this, but we'll be talking about some mandates in a few seconds, or a few minutes here, I should say. First time in history that the ineffectiveness of a medicine is being blamed on those who haven't taken it. Dr. Robert Malone. This is the inventor of the mRNA technology. When he is speaking out against the vaccine, this should be some red flags. And the people who are trying to scrub him from Twitter, LinkedIn, social media stuff, or whatever, and saying, you know, it's false, he's anti-vaccine. He's not anti-vaccine. He got the vaccine. He still had COVID once or twice. And he's talking out about this vaccine and where they're going with this. I want to see who says he's wrong and have him record it and have him debate him, because it's hard to tell that the inventor of this whole technology, that he's wrong about this stuff. Who's got the knowledge to tell him he's wrong? I want to see this person. You could scrub him from whatever you want, but his interview on the Joe Rogan Experience was phenomenal. If you have not caught and seen that, I absolutely recommend it. It's a little lengthy, about 3 hours, but it is very, very well worth hearing. But you know, some people, they don't care. It doesn't matter what you say. It's easier to fool people than to convince them that they've been fooled. You need to stay afraid. The TV, no matter even what I say, you will have a certain amount of friends that no matter what you say or do, the TV has won. The TV has absolutely won on them, and it just absolutely doesn't even matter at this point. To understand mandates that are being pushed, you got to understand where the money's coming and going. Who's funding these politicians? The heavy lobbying of the pharmaceutical companies and your politicians that get the money, you will understand why these mandates are being pushed. And, you know, some of the top funders of who's lobbying these politicians, Pfizer's right up there, number 2. Follow the money, you will find the truth. This was in the airport as I was going down for my Christmas trip. This girl has 2 masks on. She's got protective eyeglasses and a shield and a hoodie on. If you are absolutely that scared, you do not need to even be in public. Heaven forbid we had to go to war with our younger generation and pick up a gun and fight a different country. We would be screwed. I couldn't wrap my mind around this. A few days later, on my Christmas trip, I tested positive for COVID. It was embarrassing to even call COVID. I wasn't expecting to get sick, but this is all I had that I packed when I went down there. I didn't take hydroxychloroquine. I didn't take ivermectin. I took everything I have always recommended to you guys. AC/DC, zinc iodine is what I have always told you guys. We've updated our COVID protocol. If you're a patient in our office, email us, contact us. We've got your back. We have got your back. So I fly down there. I get a headache and fever. I'm not a headache person. Get a quick test, positive, fever 99. Slept that night, 12 hours, tried to sleep as much of it off as I could. 90% better the next day. Slammed my coconut water, hit my supplements. I did the buffered vitamin C hourly to bowel tolerance. Then I switched to doing whole food vitamin C hourly from there. Hourly, kept my D up, and I had natural D being out in Alabama. Day 3, I was back to normal. It was embarrassing to even call code. Oh, you must have had the Omicron. No, it's stuff I take, and if you have vitamin D at optimal levels, it cuts the severity of this stuff down. You take the right stuff and you take at the right doses. Whew, this stuff shouldn't be as difficult for many patients. 12 intervention trials conclude that vitamin C works for COVID. With a review of 12 clinical trials show that intravenous vitamin C may improve oxygenation parameters, reduce inflammation markers, decrease days in the hospital, and reduce mortality, particularly in more severe ill patients. The vitamin C is an antioxidant, antiviral, and anti-inflammatory. When I'm sick, and I've spent 3 days outside playing pond hockey in 15-degree weather, Michigan's really cold right now, and I got a little bit of a scratchy throat, I do hourly doses of vitamin C. Vitamin C has always stood the test of time. You crank that C up, and it will do wonders. I play around with different forms of it, but you could do the whole food cataplex C hourly, and you will not have bowel issues. I tell you guys, 2025, I'll go up to about 40 a day. That's how hard I'll hit it. Vitamin D status in hospitalized patients with COVID. We've talked about this. The vast majority of patients in the hospital are lacking vitamin D. Vitamin D downregulates inflammation in the body. Do you know what your vitamin D level is? It's not good enough knowing or thinking you know what it is. You need to test and take it. And I got on my wife about this because I just got her vitamin D level back today, and it was at 30. I go, aren't you taking your vitamin D? She goes, yeah, when I remember, I take it, and on and off, it's only at 30. I like to see it between 60 and 90. Going into 2020, my vitamin D was in the 80. My inflammation marker was ideal. You want to know what your inflammation markers are at, and you want to know what your vitamin D levels are at. A small molecule compound berberine as an oral active therapeutic candidate against COVID. I have noticed some very interesting stuff over the last year and a half, 2 years with COVID and berberine. I've noticed my patients that have been on berberine have also had less severity levels with this as well. I swear berberine has a little bit of an ivermectin type of mimicking property to it. Literature supports that. That was mentioned at my top 20 supplement lecture that you can also find on YouTube. And this is the berberine. I take 2 a day. This is natural metformin. I get A1Cs down. I get your crappy lipid levels down. This supplement is phenomenal. It goes after Sibo issues, candida issues, many different things. It's a very impressive supplement and heavily underutilized by many. And on that lecture, food grade lithium, everyone's depressed, angst, you can't sleep. This will be something I'll be talking pretty heavily about my next lecture with the sleep stuff, because everyone's deficient on lithium. Look at the benefits of lithium and what it does for your brain. Slows dementia, improves cognitive, and by optimizing levels of neurotransmitters, helps heal the brain from injury and stroke, reduces inflammation, helps support methylation, helps healthy cells survive. It helps the busyness in your brains. You guys can't shut down your brain. It's a lithium deficiency. Why do you have a lithium deficiency? Because some of you guys have a dead stomach, you're not absorbing your minerals, your lithium's low. The lithium's not in the food, soil, and water. We talked about this all the time. This is from Dr. Joel Wallach. 85% of our soils deplete of the minerals. If the minerals aren't in the soil, it's not in the food, it's not in the water. This is kind of going back to the beginning, because one of Dr. Tent's first lectures was based on Dead Doctors Don't Lie. And this is the big premises of his talk, is if the minerals aren't in the soil, it's not in the food, it's not in us. You can't eat an ideal diet and expect to get everything that you need, because it's just not there and in the food. I prove this to you in one of my past lectures when I talked about this using a Brix meter. You could get your fruit juice, vegetable juice, you could squeeze that down on there, put that down, you will see the mineral content of what you're eating. Prove it to yourself if you don't believe me. So, as we're getting closer to diving in this lecture, how did it start? How did it start? Well, here's my famous mom. My mom's a nurse. I was a sick kid growing up. Strep throat and earaches growing up my entire life because my mom was a nurse. And antibiotics, I was the antibiotic kid. Where are you going to get your calcium if you don't drink your milk? Drink your milk full of mucus, full of infection, antibiotic after antibiotic. For some reason, I thought I wanted to get into the medical profession. So our office is in Novi. I grew up living on the east side in the Shelby area. I worked as a patient transporter at Mount Clemens General for 4 years. It's a McLaren now. While I worked there, I got in a car accident. I had neck issues. Working at the hospital, I knew through traditional Western treatment of neck pain, painkillers, muscle relaxers, steroids, injections, is a complete disastrous route for many because at that time was the beginning of the fueling of the opioid crisis, which has done nothing but fueled a heroin epidemic in our country. Pain management through Western medicine is pretty crappy to say the least. So my buddy went to a chiropractor for hockey injuries. I went to some low chiropractic on the east side, some neck adjustments, fix up my neck. I'm like, wow, this is very cool. There's a whole different philosophy of healing. Healing from the inside out versus the outside in, minus the drugs and surgery. So I was already kind of studying pre-med. It's like, you know what? I could possibly look more into this chiropractic stuff. My ex-girlfriend that I was dating on the east side, her whole family was seeing Dr. Tent. They're like, well, if you're going to entertain going into chiropractic, you should go see this Dr. Tent guy out in Novi and go to one of the seminars and kind of see what he's doing. Went to one of his seminars. As you all know, he makes a lot of sense when he talks, but there was something that it just wasn't just chiropractic, it was nutrition. When you do them both together, it just completes it all. You know, I love chiropractic, I love it to death, but that by itself is not enough. The nutrition with it together just makes so much more sense. And his lecture was great. I saw a few more of his lectures. I was just really intrigued with the muscle testing and the technique that he was using, which was contact reflex analysis of Dr. Versendal. So I started going to some Versendal seminars, and this was in the early 2000s, and he was kind of in the transition from standard process to biotics, changing some of the technique around a little bit. So I started job shadowing all these doctors, east side, west side, up north, that were doing a lot of contact reflex analysis, CRA, and decided, hey, I really like this. I'm gonna pursue chiropractic and approach health from a different angle, because the more I worked at the hospital, and being there for 4 years, it was sick care. It wasn't health care, it was sick care. So I went down to Life University. That's where I pursued my chiropractic degree. And on my breaks, I would come up to the office and job shadow Dr. Tent. And I told him that whole entire story of all the doctors I job shadowed and how I just kind of quietly followed him through the years. And he's like, what do you want to do when you graduate? And I said, point blank, I want to work here. He goes, okay. It's like, you tell everything you just told me to my wife, you're hired. I was like, awesome, cool. That is where the journey began as far as that goes. One of the first days, I was job shadowing Dr. Tent. We go out to lunch, right around the corner here. We go out to KFC. I was like, am I getting punked? Are you punking me? I'm like, this is what you eat? It was just kind of funny. It kind of took me back when the first times I was job shadowing, we go out to lunch at KFC, because I thought I was getting punked. No, he likes to eat that once in a while. So when I was down at Life University, that's where I met my wife. Some of you guys know that my wife is a chiropractor as well. She's originally from Alabama. I met her in Georgia and brought her up here. And her practice is in Milford, New Hudson area, closer to where we live out in South Lyon. This is her office. I decided that my school debt wasn't enough, that timesing it by 2 would be a little bit better, so we've got decided to get married. These are our children, 6 and 4, Ethan and Jackson. I put these pictures up here for a reason. You know, if you guys catch some of my old lectures or new lectures and see the age of my kids, you kind of could see if it's an older lecture or a new lecture. They have not had a pinch of what my life was growing up. I had ear infection year after year, crap coming out of my ears. Drink your milk, gotta get strong bones, keep drinking your milk. Antibiotic after antibiotic. They have not seen, you've seen zero of this. This is my medicine cabinet at home. This is my medicine cabinet. I would love to go through your houses and look at some of your medicine cabinets and see what you guys are taking, because this is real medicine. And I tell you what, they're coming for your kids. They're coming for your kids. Reports of COVID vaccine injuries past 1 million mark. FDA signs off on Pfizer boosters for kids 12 and up. And on top of that, you know, this 5 to 11 age and approving this vaccine for kids. Everybody look out. These kids have no voice. You parents better wake up and be the voice for your kids with this, because they are coming for your kids. And they already are, as you already see at the college level. We got colleges in Michigan that you can't go back until you get your 3rd booster vaccine for school. This is how out of control this is getting. So I get out of school and, you know, I want to boost my nutritional credentials. You know, I was looking at, you know, Dr. Tent pursued more the naturopathic degree, kind of got, you know, a bit grandfathered in with some of that. I was looking at a bit of a different route, and I chose functional medicine. So did the functional medicine university program as far as trying to increase my nutritional credentials. What is functional medicine exactly? Functional medicine addresses the underlying causes of disease using a systems-oriented approach and engaging both patient, practitioner, and therapeutic partnership. It's an evolution in practice of medicine that better addresses the healthcare needs for the 21st century by shifting the traditional disease-centered focus of medical practice to a more patient-centered approach. Functional medicine addresses the whole person, not just the isolated set of symptoms. One condition, many causes. One cause, many conditions. Depression is not a Zoloft Prozac deficiency. Issues of omegas, issues, gut issues, thyroid, adrenal issues, vitamin D, prediabetes, you name it. B vitamins on top of that. Functional medicine is cost-effective, systems-oriented, patient-centered, health-focused, root cause, looking at that long-term restoration of health, recognizes biological uniqueness, synergistic approach, preventative measures. You use the right things at the right doses, you get good results. Don't underestimate the nutrition and the body of what it's capable of. Some of the labs that I use Genova Labs, LabCorp, doctor's data. That's just a few of what I offer. And I actually got a cool announcement too. If you're a patient in Michigan, and even out of state, but you do come to Michigan, Dr. Gills actually brought some cool things to the office. Now we can actually run blood work for you and use your insurance and have your insurance cover it and actually save you guys a good chunk of money. I know paying out of pocket with some of the labs definitely could add up, and you know, with gas prices, food prices going up, we're always kind of looking out for you guys to kind of help you out. But you know, it's something that we really haven't talked much about, and I don't think too many patients know of just yet. If you want blood work and you want to save some money with it, if you are in Michigan, we could use your insurance and send you out to one of the labs around here and have that done. This was the very, very, very first lecture I ever did for DHS, and it was not recorded, addressing the symptom survey form. If you want to follow along, if you want to fill one of these out and follow along with me, here's the form. It's a 2-sided sheet. Email the office, questions at Diverse Health Services, and just title it Symptom Survey Form, and we will email you this exact form so you could go along with us. The first section, Group 1, sympathetic dominance. Symptoms that acid foods upset you, get chilled often, lump in the throat, dry mouth, eyes, nose, pulse speeds up after meals, keyed up, fail to calm, cuts heal slow, gags easily, cold extremities, strong light, irritation, urine amount reduced, heart pounding after you lay down, nervous stomach. These are the people that are just keyed up. Unfortunately, 2020 and all this COVID stuff has just, people are stuck in this fight mode, and you feel like this every single day. You will burn through key nutrients like calcium, magnesium, potassium when you're stuck in this mode. That's the first group on this form. You can fill it out 1 to 3, 3 being if it's very often, 1 if it's not mild symptoms and not really much going on with that, but that's the group 1 section. Group 2 is the parasympathetic, so you got fight and flight. This is more rest and digest as far as this goes. Joint stiffness after arising, cramps in your legs, butterfly stomach cramps, eyes, nose, watery, blinking often, puffiness under your eyelids, indigestion soon after meals, always seems hungry, lightheaded, blood sugar issues a lot with someone who's parasympathetic dominant as well. Breathing irregular, slow pulse, gag reflex a little bit slow, difficult swallowing, constipation, diarrhea, alternate back and forth. These are your slow people, slow to get going type of thing. Steady Eddie, as Dr. Tent used to call them. So your sympathetic dominant, parasympathetic dominant symptoms all affect different areas of your body, your eyes, mouth, skin, palms, lungs, heart, blood, adrenals, and digestion. It all either stimulates them or decreases them, and these are just the symptoms on each side there. This is stuff that I have addressed in my adrenal lecture. In the standard process, we use 2 key nutrients because a lot of people, your top deficiencies, and the top deficiencies among Americans are your B vitamins and your magnesium. A lot of patients, your pop, tea, coffee, alcohol, diuretics, but primarily your sugars and carbohydrates will deplete your B vitamins and your magnesium. We use 2 key B vitamins at the office, Cataplex B, Cataplex G. I am more of a G person because I've got more of the crummy cholesterol numbers, genetic numbers, and this has more lipotropic factors kind of help keep the numbers down a little bit. If you got more of depression, lack of, the pulse kind of palpitating, that kind of thing, that thiamine, this has more of the B1, that thiamine component, feeds the pacemaker to the heart. That thiamine also feeds the frontal cortex of the brain, more dopamine, more push, more motivation. People with the severe depression, we really crank more of the B. The B's get you going, the G's calm you down. Both B vitamins, but a little bit more different. More, if you're more sympathetic dominant, go, 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 go. The G's will calm you down. If you're more parasympathetic, slow and steady, slow and steady. The B's get you going. And that was on the Battling Adrenal Fatigue lecture that you could find on YouTube. Now, I run a lot of cortisol testing. This is run $65 through Genova, and then they use your insurance. But if you want to see what your cortisol is doing all throughout the day, it checks it 4 times throughout the day. It's a lot more accurate than running blood cortisol. That is ideal. If your cortisol is off, it throws off all your hormones. I got too many patients that come in here think this is my hormones, it's my hormones, it's always my hormones. But the first thing I'm going to look at is your cortisol levels, because if your cortisol is off, you can't fix your hormones until you normalize the cortisol component first. But a lot of you guys have too many issues with stress going on in life. You need to cut out certain things with stress. It's 2022. Turn off the TV. Cut things out of your life because it is absolutely killing you guys right now. I'm seeing you guys in this office. It emotionally takes a toll on me. I'm cooked at the end of the week because I'm helping you guys carry some of this emotional burden of things you bring in an office and job losses, this, mandate, whatever, this, that, stress, divorces. I've heard it all. It sucks. I understand. But if you could cut out some of these stressors, because you cannot be stuck in the sympathetic dominant mode, stress will kill you. A lot of you guys need a social media detox. I decided over my Christmas break to just completely disconnect from everything. I logged off of all my social media outlets. I'm just like, I want to disconnect. I've had it. I've mentally cooked. Sometimes I feel like I can't get a break. I love being there for you guys, but man, the emails I get, the messages, and people hunt me down on other social media outlets and kind of ask me questions. I feel like I don't get a break sometimes. So I had to completely disconnect. And when I came back to it after 7 days, I felt very, very refreshed. I changed some things. I don't want notifications on certain things, turn notifications off, and I still logging out of certain things because I need to disconnect for my mental health. Do you need a digital detox? Are you spending a large amount of time on social media? Thinking about social media often when you're not using it? Spending less time doing other activities, hobbies, or spending time with others in order to use social media, using social media to the point it negatively affects different areas of your life, work, school, relationships, experiencing negative feelings, irritability, anxiety, depression, you name it. I kid you not when I say your teenagers that I see in this office and the amount of anxiety and depression that I see with your teenagers is so heavily driven by this crap. This social media has become an absolute curse. Now it's pushed everyone into having TikTok brains. Group 3, sugar handling. Eat when you're nervous, excessive appetite, hungry between meals, irritable before meals, gets shaky if hungry, fatigue, eating that relieves it, lightheaded if meals are delayed, heart palpitations if meals are missed, afternoon headaches, overeating, sweets, upsets. This is very common and something I'll talk about in my sleep lecture as well. Awakening after a few hours of sleep because your blood sugar bottoms out. You'll have a hard time staying asleep at night because your blood sugar kind of bottoms out. A lot of sugar handling issues. I had sugar handling issues, and getting back to this whole anxiety, depression stuff, I had panic attacks when I was a kid because my sugar handling sucked. I lived on sugar, and I was a chicken nugget kid, and if it wasn't chicken nuggets, I wasn't eating it. Sugar and chicken nuggets, and my blood sugar crapped out most of the time, and I had anxiousness, anxiety, and panic attacks because everyone missed what hypoglycemic symptoms I had growing up as a kid. Bioglycozyme and Paraplex are supplements that we use at the office to help prevent this reactive hypoglycemic dip with your blood sugar. Up your protein because it's got the amino acids. Your brain's 60% fat. Fat and protein feeds your brain. Feed your brain, balance your blood sugar, keep your B's up. I'll go through the schools and fix half this anxiety and depression by turning off the social media and feeding your kids properly. Cardiovascular group. Hands and feet go to sleep easily. Numbness, sighing, the air hunger, breathing heavily, high altitude discomfort, opens windows in a closed room, susceptible to colds and fevers, afternoon yawner, drowsy, swollen ankles, worse at night, muscle cramps, worse during exercise, the Charlie horse stuff, shortness of breath on exertion. This is all the cardiovascular group. A lot of this stuff, especially the cold extremities, may be mixed up a little bit with some anemia, which I'll show you the protocol for that. But if you have a lot of these symptoms, we've had great lectures. Dr. Tent, Dr. Gill, myself all have a cardiac lecture if you want to check out our heart lectures. But if it's more anemia, and I'll look at your nails, if it looks like someone's pressing your nails and it looks like they're white, you're anemic. If you're yawning a lot, eating ice chips, you got the white nails, that's anemia with a lot of people, regardless if your blood work shows it or not. Chlorophyll, chlorocaps, hematic formula, B12, looking at your digestion, this is what helps the anemic people. If you're female, control the periods. This whole estrogen dominance and heavy cycle stuff is killing you guys and pushing you anemic because the cycles are just disastrous. And I'll talk about that a little bit more later in this lecture too. But this was my lecture was the paleocardiologist, You could find that on YouTube, but like I said, Dr. Tent, Dr. Kill, all have great heart lectures, and Dr. Gill's was the most recent as well. And check them all out. Group 5, biliary and liver. This is something that we see when the top 5 things we treat in the office. This is going to be right up in the top 5. Dizziness, dry skin, burning feet, blurred vision, itchy skin, feet, excessively falling hair, frequent skin rashes, the metallic taste in your mouth, bowel movements, painful or difficult, warrior, other symptoms like this, and stomach pains during the middle of the night, 11 to 1 a.m. is very common. Stools being off, light color, loose, constipated type of thing. This is all liver, gallbladder stuff. Unfortunately, a lot of our foods in our country absolutely wreak havoc on the gallbladder. And those rancid oils, and even cooking with rancid oils, if you're not using oils that have high smoke points, they will go rancid easier and stir up your stomach. But eating out these restaurants, the oils will cook you, get the gallbladder all stirred up. Gas, bloating, indigestion, going between loose and tight stools, burping, belching, gurgling in the stomach. This is all gallbladder stuff. So much gut stuff I see in the office. I have a heavily focused gut practice with a lot of my patients, because 80% of your immunity is through your gut. People aren't digesting, and I need to fix a lot of guts first before I move forward with a lot of people. And the gallbladder stuff is some of the most common things that I see in the office. There's a real clinical key to this as well too. bad food has beets in it. Beets thins the bile, cleanses the gallbladder, but patients that have this IBS-like symptom and the beta food and beta TCP or gallbladder stuff really isn't fixing it, Sibo is becoming a lot more common, and I can guarantee you if the beta food isn't fixing it, 90% of the time you've got underlying Sibo problem, and I'll talk about that in a second. Digestion, and the lack of stomach acid. All the people that have sold you that you need to be alkaline. This is why Dr. Tent and I we don't like to talk about this whole alkalized lid, because everyone's missed this. Look at all your symptoms of group 6. This is digestion. And like I said, if you want to get this form, email the office, questions@diversehealthservices.com. You could follow along with this whole entire thing. But group 6 digestion, loss of taste for meat, lower bowel gas several hours after eating, burning stomach sensation, eating relieves, passes large amounts of foul gas. This is a dead stomach, lacking good stomach acid, not digesting your foods. All these foods ferment, putrefy, rancify, go south, and give you all these symptoms here. Learn to use your stomach acid. As we age, it's a declining process of digesting your foods, and you need more acid as you get older. I had a vegan patient in today, and I could tell just from her lab work that she got a dead stomach and isn't absorbing things. And I told her, I'm like, I could guarantee you're most likely vegan because you just eat meat and it doesn't go anywhere. She goes, exactly. I'd say more patients will say they're vegan, vegetarian just because they can't digest things. And I don't recommend one diet to all patients. I stay away from doctors that recommend one diet to all patients. I recommend different diets to all types of different patients. I prefer paleo keto for myself, certain patients that got dead digestion. I'm going to push them more towards a plant-based diet and doing food combining along with it. Certain cancers and treating patients, I may push them more keto, I may push them more vegetarian. It really depends on what I'm dealing with. There's no one diet that suits everyone per se. But learn to use your stomach acid, because as we age, you need more stomach acid to help you digest your foods. And if you're dealing with these symptoms of group 6, you need more stomach acid. Health begins in the gut. This was on YouTube. If you are interested in more of the gut stuff, this is lectures all over on YouTube. Other symptoms that are common, the low stomach acid, like I mentioned, the bloating, indigestion, gas, belching, feeling of excessive fullness after meals, heartburn, acid reflux, mineral deficiencies. If you don't have enough good stomach acid, you're not going to absorb your minerals, you're not going to absorb B12, and your immune system to your gut is going to be compromised. So dysbiosis, yeast, and parasites are going to be issues. The bad breath comes from if you're not digesting your foods, the gases of those foods come up and give you issues. So very easily seen without even muscle testing. So getting back to the Sibo, what is Sibo? Sibo, small intestinal bacterial overgrowth, is a condition that occurs when an excessive number of bacteria colonize the small intestine. It causes bloating, diarrhea, or constipation. And it heavily mimics what IBS, what a lot of people who are just lumped in this IBS, irritable bowel syndrome. And like I said, if you're being treated for gallbladder issues and you're not responding like you should, it's more than likely you have Sibo issues. What are symptoms with Sibo? Nausea, bloating, vomiting, diarrhea, malnutrition, weight loss, joint pain, fatigue, rashes, acne, eczema, asthma, depression, rosacea are symptoms of Sibo. This is an interesting case I'm working on. This is a young girl, probably mid-20s. Hormonal support, irregular periods, left side abdominal pain, heavy cycles. It's number 2 where what's been really interesting with her. She's had these tongue sores randomly since she was 14. She's mid-20s. She's got the geographic tongue, which is pretty common with B vitamin deficiencies and dysbiosis on the gut, and just these burning sores in her mouth. And she's got braces, so we're trying to treat the staph infection stuff with her as well too. And it's been a bit of an uphill battle. And she's responded lately, then goes backwards. Finally ran a Sibo test with her, which is a breath test, and she just lit this up on fire. So now I'm doing a very aggressive Sibo protocol that we have at the office for her, which works very well. Some of my worst acne cases that I've seen in the office have responded very well with our Sibo protocol, and using the biofilm busters with that as well. But this is a kit you could run through the office. This is Genova Diagnostics. It's $85. Then they use your insurance. Email the office, contact me. This is simple stuff. You could get it at the office. You could pick it up, or I can drop ship it if you're out of state. It's just if you got IBS and you're cutting out all these food things and you're just not improving, not treating a gallbladder, doing a stomach acid, and you're just not going anywhere, it's a good likelihood Sibo is the main culprit. So we're going to dive into the endocrine system here. Male and female, you got the pineal gland, hypothalamus, pituitary gland, thyroid, parathyroid, adrenals, pancreas, ovaries, testes. These are all the endocrine organs. So if you're following along on that form, group 7A, the endocrine system, this is hyperthyroid symptoms. This is your thyroid going too fast. And when this thyroid's going too fast, you feel angst. You are so keyed up. Your heart's racing like crazy. Your eyes may be bulging. You got the nervousness, can't gain weight, intolerance to heat, highly emotional, flushes easily, night sweats, thin, moist skin, inward trembling, heart palpitations, increased appetite without gaining weight, the racing pulse, eyelids, face twitch, irritable restless and whatnot. Your TSH should be 0.45 to 4.5. These are patients that they're 0.45 and below, and their thyroid is just running like crazy. These thyroids are very difficult to get under control. We would much rather work with a hypothyroid versus a hyperthyroid, but one of the first go-to things that we'll use is vitamin A at high doses to get that thyroid to calm down. Unfortunately, even traditional Western treatment kind of sucks. They'll try one medication, a second medication, it don't work. Either take your thyroid out or use radioactive iodine, kill your thyroid, and put you on thyroid medication for the rest of your life. And I could tell you about 80% of the patients regret even having that procedure done who have gone the full route with that. On the other end, hypothyroid symptoms, this is group 7B, increase in weight gain, decrease in appetite, fatigue easily. Fatigue first thing in the morning when you wake up, ringing in the ears, possibly, but not always. Ringing in the ears could be an inflammation issue in the body. Sleepy during the day, sensitive to the cold, dry skin, constipation, mental sluggishness. Depression should be even mentioned somewhere around here too. Low-grade depression is very common with hypothyroid stuff. If your TSH, ideal should be 1.0 to 2.0. If you're above that and even out of the range of 4.5 and above, that's going to be more clinical hypothyroid. That needs to be addressed. And that's a complex thing too, as far as if it's Hashimoto's, if you get the thyroid antibodies or the TPO factors up. That's all addressed in the functional medicine approach to your thyroid diet. You could find that on YouTube as well if you want more in-depth information on that. I got a bunch of lectures. I'm just trying to point you guys towards, if you're going through the symptom survey form, direct patient treatment and having an ideal supplement protocol for you still is obviously the most ideal thing. Group 7C, pituitary hyperfunction. A lot of times with patients that have a real true hyperthyroid, there's going to be a tumor on your pituitary, making it produce too much hormone. And a lot of times, as you see, the giantism with individuals as far as that goes. But other symptoms: failing memory, low blood pressure, increased sex drive, headache. Depending on the size of the tumors, that can't really expand much in that skull cavity. You'll get a splitting headache. That's no fun because that tends to be more surgical and kind of out of our hands. A pituitary that is underactive, on the other hand, may not always be out of our hands. And symptoms of that: abnormal thirst, bloat in the abdomen, weight gain around hips and hips or waist, sex drive reduced or lacking, tendency to ulcers, increased sugar intolerance, lack of growth. And something I should, lack of, actually what it should really be mentioned on here too, lack of growth in individuals. Your children, lack of growth, one of the first go-to things that we'll treat is a hypopituitary. Cytosine PT-HPT, a Biotics research, is glandular pituitary. And probably the reason, I laugh about this now, the reason I say I'm the shortest in my family is because of this supplement. My younger brother, who's 12 years younger than me, was the short, small runt kid of our family. I put it, he's was under growth forever, doing zinc and pituitary. He shot up. Now he's taller than me, and because of this pill, now I'm the shortest one in the family. Now, group 7E, adrenal hyperfunction. These symptoms: dizziness, headaches, hot flashes, increased blood pressure, hair growth on the face, sugar in the urine, masculine tendencies. This, real hyper adrenal issues could also be related to problems with a tumor on the adrenal glands producing some of these things as well. Some people are just continually stuck in that hyper adrenal situation just because of stress and that sympathetic dominant stuff. Tumors, that's something that nutrition you won't respond to, but if it's more the sympathetic dominant stuff and changing some things in your life, that and supplements will work phenomenal. Some of you guys are absolutely cooked and your adrenals are kind of shot, or you just got more of the tendencies to weak adrenal issues. And this is weakness and fatigue, chronic fatigue, low blood pressure, ridges or weak nails, tendency for hives, arthritic tendencies, bowel disorders, poor circulation, swollen ankles, crave salt. Allergies is very common with this. Dizziness from sitting to standing. One of the key symptoms, if you're prone to dizziness from sitting to standing, you have underactive adrenals. That and the allergies are very common. Using the good salt, Celtic salt, even Himalayan salt, glandular supplements, and your B vitamins, your licorice root, playing this stuff aggressive. And I talk more about this at the adrenal lecture, but these are things that we will treat a lot at the office. And it's key to note that hypothyroid symptoms and hypoadrenal symptoms are very common, and you need to know which one to treat, because I get a lot of thyroid patients in here like, oh, I need my thyroid treated, I need my thyroid treated, and the thyroid's in range, and yet their symptoms that they're having are more adrenal than is actually thyroid related. Foundational issues, male and female. Females, very easily fatigued, premenstrual tension, painful menses, depressed feelings before menstrual cycles or menstruation, painful breasts, vaginal discharge, acne worse around your cycle, depression. There are so many things, and this is becoming more and more difficult, and infertility should be right in the mix with all this as well. The female stuff is becoming more and more challenging to treat because of so much of what you're being exposed to. It is affecting the menstrual cycle heavily. And this is beating a dead horse that you hear me, Dr. Tennant, Dr. Gill continually talk about, is all the exogenous estrogens that people are all the crap you guys are being exposed to, the food, the water, the air, mimics estrogen and is crapping up your female cycles like crazy. You want your leafy greens with the sulfuric compounds to remove this stuff because it is killing your cycles, and it's affecting everyone on some age range, whether it's males and prostate cancers, females and breast cancers, middle-aged women with a further fueled estrogen dominance of PCOS, endometriosis, fibroids, low sperm counts with the guys, gender bending issues with the young boys, early breast development with the younger girls. Every age range, it's affecting someone. That's one of the reasons I kicked this thing to the curb a long time ago. If you're going to store water in plastic and then shoot hot water through more plastic and drink that daily, you're getting plastic every single morning. I don't even care if it says the stuff's BPA free. I guarantee you plastic is leaching from that somewhere for sure. Getting in the males, here's some of the symptoms, that are the foundational things with the guys. If you're following along on the symptom survey form, I had a great lecture on I dedicated to the males as well, and there's 4 things that are killing the males. Now we just talked about number 3, the exogenous estrogens, xeno meaning false estrogens, all the chemicals, plastics that you're being exposed to is mimicking estrogen. Stress, and I keep going back to this. You've got to cut out stress out of your life the best you can, because stress is making your cortisol go up, which will make your testosterone go down. Everyone who's scared about your cholesterol levels, and your doctors that think statin medications are miracle drugs, if you lower your cholesterol, you are going to lower your testosterone. That's your number 2 killer. We talked about xenoestrogens. 4th is the sneaky thing, passive transfer of things. This is sleeping with your spouse who's doing hormonal treatment, whether it's topical or internal hormone replacement therapy, passive transfer, sex, sweat, saliva, passively getting hormones from your partner. That's the sneaky one. That was on addressing male health, which is also on YouTube as well. Got a story about someone close to me, my neighbor, about this whole stress factor since 2020. General Abdication syndrome. The body responds in different ways to short-term stress and long-term stress, following a pattern known as general adaptation syndrome. Gas. A lot of you patients have gas, like literally. The function to prepare the body for extreme physical exertion. Once the stress is relieved, the body quickly returns to normal. But unfortunately, some of you guys are stuck in this go mode. There's the alarm phase, the beginning, the continued phase, the resistance phase, and the burnout phase. And I talked about this at my adrenal lecture, but we're going to jump right down to persistent stress. If you're not getting this stuff under control, what is it doing to you when you're at the bottom and you're in this burnout phase? During the final stage of adrenal fatigue, an individual can suffer from extreme tiredness, lack of sex drive, irritability, depression, anxiety, weight loss, apathy, and disinterest in the world around him. This was my neighbor. He was stuck in the burnout phase. And when you're out in the burnout phase, all of your hormones are completely shot. You will have low testosterone, low cortisol, low everything. His cortisol and adrenals are completely shot. Stressed out about work, life, what Q's telling him, where the world's going, things that are out of his control. Absolutely cooked him. And I told him, you got to turn off the TV. You got to get off all the social media outlet news, whatever. There's things that you cannot control. It's out of your control. Let it go. I love giving you guys encouragement at the end of my lectures. Cast your cares on the Lord, and He will sustain you. He will never let the righteous be shaken. there's another part of this story I probably should have mentioned earlier when I just said where did it start from the beginning. I dealt with anxiety. I dealt with depression, a lot like you guys. In my early 20s, trying to find my purpose in life and just being frustrated with life and just not knowing what direction to go and trying to find purpose. Came across the book, The Purpose-Driven Life by Rick Warren. Led me in my Christ-driven life. Opened doors in my life that to this day I still cannot explain. Is more than not the main reason I'm here giving you this talk today. I don't worry and I don't sweat about the stuff that I used to. I don't have that anxiety, I don't have that depression about things that are out of my control. It's all in God's hands. I don't worry about it. So, where do you start? Where do you start? Well, if you've gone through this lecture and now you emailed the office and you got the symptom survey form, you filled that out, you could start with the symptom survey form, come in, get muscle tested if you want some of the muscle testing, blood work, hair analysis, advanced functional medicine testing. We got cool routes with a lot of patients. So I got a new patient startup package. If you want to be a new patient at our office, Skype or in office, new patient appointment, hair tests, and the Abdication blood panel. This is a physical-like blood work panel with a urine analysis. $300 for an inpatient appointment. That's a $100 savings. If you're a Skype patient, new patient appointment, hair test, Abdication blood panel, $400. That's an $80 saving. You could even save more if you have insurance, and we could use that new form and use your insurance to run blood work. So I'm working hard for you guys to save money. I've said it in the past, but I am the Robin Hood of functional medicine. I will steal from the rich and give to the poor and try to help you guys out in any which way I can. I hope you guys enjoyed tonight's lecture. These are, I'm jumping ahead of myself. These are some of the more advanced functional medicine testing things that I could run. We got different blood testing stuff that we could do, heavy metal testing, whether you want to do hair, blood, urine, stool testing, Sibo testing, cortisol, hormones, viral panels, food sensitivities, you name it. These are just some of the things that I run as far as more advanced based testing. Main supplements that we use, biotics research, standard process, doctor's data, trickling in a little bit more orthomolecular now. Just, we need to fill up some gaps of certain things that we like that are on back order so we could keep going along. Previous lectures on YouTube. And the end.